Right, it is 6:05, so I'm going to go ahead and get started. If anybody else is able to join us throughout, then they certainly can, but we'll go ahead and get started. So we have plenty of time for questions at the end. So today I am here with Dr. Marta Cordell to talk about thermography. She is a doctor of naturopathy, a certified health and nutrition coach, a certified thermography specialist, and she's the senior holistic practitioner at the Thermography Center of Dallas. She is passionate about giving people the tools they need to take charge of their own health, as we are at Flourish also.
Yes.
So Marta, go right ahead. I see a note that somebody isn't able to hear. It doesn't look like I'm on mute. Marta, are you able to hear me okay?
I can hear you.
Okay, and Mike can hear me. Okay, good.
Good, good. So yeah, we'll just jump right in. So today I'm going to talk to you a little bit about thermography. Thermography is a whole body diagnostic tool. It's designed for functional practitioners. So if you're not familiar with functional medicine, what functional medicine is actually looking for the root causes for any dysfunction in the body and solving that. Because if we can solve the root cause, then all the other symptomology also disappears. So it is designed for functional practitioners to help them find root causes. So I have a little PowerPoint and I'm just going to share my screen. Let's see. That one. Share. Come on. There we go. Okay, so today we're going to talk about ways to help you be more in control of your own health by having the information that you need in order to know what's going on in there. And so we're talking about thermography today. You may or may not be familiar with thermography. Many people are not. And many of the people who are familiar with thermography are really familiar with camera thermography. And that's very different from what we do. They're related, but not the same. And so we'll talk about a little bit of those differences later on in the presentation, but that's kind of where we'll start. So how well do you really know your health? You know, and we do a lot of testing, right? People do a lot of testing. They do blood testing, urine testing, all kinds of other things. MRIs, CAT scans, you know, a lot of different types of testing, but what do they really tell us about our health? And, you know, are they really getting to the root of the issue? You know, very often people bring us their blood testing and they say, take a look at my blood testing and, you know, tell me if there's something going on there. Well, we can do that, you know, we can look at it, but truthfully, the last place things are going to show up is in the blood. So, you know, we're trying to kind of come at it from a different angle with the blood testing, which is to see where different levels are and see if we can tell if dysfunction is beginning in the body. But usually by the time it shows up in the blood, it's kind of way off down that path. So we prefer to find things much sooner. And this is one of the things we can do with thermography. So what is thermography? So as I said, it's a functional diagnostic tool, which means that we're looking at how the organs and tissues are functioning. We're looking for root causes. It reveals the function of all of the organs, also the lymphatic system. In fact, it's the only thing that tests the lymphatic system. It also looks at the teeth and gums and the health of the mouth. The cardiovascular health, the endocrine health. So a lot of different levels and how all these things are interacting as well. For women, it gives an entire page on the breast health. And for men, it gives an entire page on the prostate health. It's non-invasive, radiation-free. There's no breaking of the skin. There's no mashing, no squeezing, you know, so it's very comfortable and non-invasive. And It's just a snapshot in time. So just like fingerprints, no two thermograms will ever be alike. So you could take a thermogram and then come back the next day and take another one, and they will be potentially very different. So it is FDA accepted for a number of different conditions, and it's accepted as an adjunct diagnostic tool, which means that it's made to be paired well with other testing. So for example, when you pair a thermography exam and a mammogram together, the chances of catching a tumor early on is close to 95%. So by comparison, a mammogram by itself or a thermogram by itself is a little lower. And so it can be a really good tool to use alongside other tools as well. But we find that there's a lot of information in thermography that can be used all on its own. So it's used by many different holistic and functional specialists. Here in town, we have Dr. Ann Coleman, who's a big partner of ours. She's an MD. She's been using thermography for many years to help assess her patient's health and get early warning, of anything that might be starting. Also, Christiane Northrup is a well-known OBGYN. She wrote Women's Bodies, Women's Wisdom, and she has been a huge supporter of thermography for many years. It originated in Germany about 40 years ago. It was created by a doctor and a dentist. They were working in the hospital at the time, so they did a 15,000 person study and correlated it with many of the testing technologies that they had at the time. So MRIs, CAT scans, blood testing, a lot of those different things. It's extensively used in Europe. Dr. Thomas Rau at the Paracelsus Clinic, which is the largest holistic clinic in Europe, in Switzerland, doesn't see a patient without a thermogram. And as a rule, we don't either. So it's very widely used. It's been very well vetted over the last 40 years. And it's not very well known in the US though. So this is really important, seeing the whole picture. We have different stages of dysfunction in the body. And, it's kind of like an iceberg. A lot of this stuff is under the surface and you can't see very early on. So small changes in the tissues that begin way before dysfunction shows up, way before things become symptomatic. And so, once it gets to the place where we can see it, we very often have degeneration of the organs, degeneration of the tissues, and it's a whole lot more difficult to change that once it gets to that point. So it's really important for us to find these things very early on. And one of the things that thermography does very well is it sees very small changes in the tissues that begin sometimes 7 to 10 years before they manifest symptomatically. So it can be a very good early warning system to know when things are starting to shift so that you can make some changes on that end and very quickly bring the body back into balance. So the other important thing to understand about thermography is that we're looking for root causes. And there really only are a few root causes for all the dysfunction that we see. One of those things is viral, yeast, bacterial infections in the body. And, these can be clinical infections, they can be subclinical infections. Clinical infection is where you run fever, you feel sick, you want to stay in bed, you might be having things like vomiting and diarrhea. But that's a clinical infection. A subclinical infection is when microbes just make a home somewhere in the body, and it manifests itself in very different ways. So things like fatigue and hair loss and skin rashes and different things that you might not immediately associate with infection. Also, heavy metal and chemical toxicity is a big root cause. Lymphatic blockage, so the lymphatic system not moving very well. And then also subclinical infection in the teeth and gums. And that's really, really important. We'll talk about that in a little bit further later on. But all of these other dysfunctions in the body, really, these are the root causes of those. So that's what we're looking for with the thermography testing. So, how well do you know the root causes of your health issues? So here's just a little bit of a comparison between camera thermography and regulation thermography, which is what we do. Camera thermography basically takes an infrared image of an area of the body. And it's good technology, and it can tell us quite a bit. It can tell us where we have hot spots, where we have cold spots. These can be indications of dysfunction in that area, but it doesn't really get to root causes. So it'll tell you if there's a cold spot, for example, in the breast. Very often we see breast thermography. And so that means that there's something going on there, but it's not going to tell you what the contributing factors are. It's not going to tell you what kind of dysfunction it is. And this is where regulation thermography makes a big difference. So we're literally measuring the temperature at the skin. So we have an actual temperature reading rather than just a range. And we can also tell, how the body is responding to a cooling challenge, which is really important. And really how all of these different areas and tissues of the body are interacting. So it gives us a lot more specific information.
Marta, I have a question. Did you say that it was that you would notice a cool spot in the breast as being a concern and not a warm spot?
No, warm spot would also be of concern. So if we have anything out of that normal temperature range, yeah, this is an indication to us that we have some kind of dysfunction. And interestingly, usually when the body is showing heat, it means that that area of the body is working really hard on something. So if it's in the immune system, or if it's in the lymphatic system, then it's working really hard to clear something, right? Mm-hmm. If it's in one of the organs, that organ is working really hard to clear some toxicity there or something of that nature. If we're seeing cold, this indicates to us that we have a more chronic condition. It's been there for a long time. The organ's been working and working and working, and it's not able to clear whatever that is. And so it becomes fatigued after a while, and we start to see cold. So they're both areas of dysfunction, but just a different type.
That kind of correlates if we've got somebody with a toothache, usually in the beginning stages of the nerve dying, it will be painful, hot. Mm-hmm. It'll be hot to the touch sometimes. Their cheek will feel warm. Once the nerve completely dies all the way, then all of that goes away. It's no longer painful at all. It's just a dead, dying, decayed tooth.
Yes. So that is exactly what we're seeing. So it in the beginning, the body really mounts a major response. But then, as things progress and it's been there a really long time and those tissues, really are just not functioning well, we start to see that cold.
It gives up.
Yes. Yes. So the thermography is done in a 3-phase procedure. So we start out by measuring the temperature at the skin at 119 different points on the head and torso. And then we have the patient remove the outer clothing down to the underwear. We put you in a nice private temperature controlled room. And we just have you sit in there for 10 minutes. And so this is submitting the body to a cooling challenge. And then we come back in and we take all of those points again. And so what we're measuring is how that body responded at all of these different points to that cooling challenge. Each of the points corresponds to a different tissue, organ, area of the body. And so depending on how that particular point responded to the cooling challenge, we can tell, whether there's inflammation there. We can tell if it's, chronic. We can tell if it's acute. We can tell if there's any kind of dysfunction going on. So it's a very easy test. It takes about 30 minutes. And then it's also immediately available. The results are immediately available, so there's no waiting, which is very nice. So especially if you're waiting to hear, about something that you're very concerned about, you don't have to wait, for a couple of weeks or a month to find out what the results are. So here are all the points that we measure. So as you can see, we actually measure each individual tooth and the gums surrounding that. So we have 32 points just for the dental health. We have lots and lots of points on the head, on the body, a lot of lymphatic points, organ points. For the breast exam, we have actually 26 points that we measure just on the breast. So it's a very thorough exam. And you can see to the right there all of the different organs and tissues and things that it's measuring. So the report itself that it generates is a 6-page full color report. You can see a little bit of a sample here. We're going to kind of walk through that page by page so that you can really see what kind of information is on each of the pages of the report. But it's a very comprehensive report and very easy to very quickly see where we're having any issues. So the first page is the summary page. It has, a little bit of patient info at the top, and then it has a summary broken down by the different areas of the body. And so it's going to show us on this page any dysfunction that the thermography exam may have found. And then it also gives us at the bottom priorities for treatment. Now, these aren't necessarily in order of priority, but these are the top 6 priorities that the testing found that really need to be addressed. On the second page, it gives us a 2D pictorial representation. So on the left side, it gives us a representation of the first set of readings. And then on the right side, it gives us a representation of the second set of readings after the cooling period. So how the body responded to that cooling period. And it gives us a nice color key. And as you can see there, lots of pretty colors going on in the neck, lots of lymphatic stuff. So it gives a really good way to see very quickly kind of where any issues might be. It gives us a full dental analysis page. So this is something that I think Dr. Ingram has found very useful. Can you talk about that just a little bit, how you're using that in your practice?
Yeah, so it's been a huge help because x-rays, images, clinical exam, that's only part of the story. We know, I know that if something is showing up on the thermography report that I have not yet seen clinically, I know I need to dig a little deeper. And so then we start having discussions about, is somebody grinding their teeth, or are they clenching it? Are they hitting heavy in one area or another? Maybe one area lights up that's wasn't a concern for me clinically, but they've got a metal crown that maybe is detrimental for that person. People can have different sensitivities to different materials. So it just helps us dig a little deeper so that we're not missing anything, because any number of things that are going on in your mouth could potentially be a roadblock to your healing or to you being as healthy as you can be. So it's been a huge help.
Wonderful. Yeah, and so that's very interesting. Very often, because this sees small changes in the tissues, sometimes before the symptoms manifest, we find very often that people will take this to their dentist, and the dentist will look at any teeth that are having an issue, and they'll say, I don't see anything. We'll see like an active infection. And they'll say, I don't see anything. But then 2 to 3 months later, they go back to the dentist and they have an active abscess, or something of that nature. So yeah, it gives you a way to kind of see maybe things that are coming.
Mm-hmm.
Yeah. So it also gives us a little chart here that talks about the connection between the teeth and all of the different organs and tissues. Each of our teeth actually sits on one of our acupuncture meridians. And so anything going on with that tooth, if it's in the tooth or if it's in the gums, it very often can affect any and everything on that meridian. So this connects to different organs, different tissues, different joints, different vertebra. So this gives us a little chart that shows us all the different things that the dental can be connected to. And this is really important because, we've actually seen patients where they had an issue with a tooth and they were having issues in other places in the body, and it was very much correlated. We had one lady who had a pain in her toe, and she had been to the podiatrist, she had been to several other doctors, she had had all kinds of testing done, and they were like, we don't see anything wrong with it. And they couldn't really give her any answers. Well, she had one of the teeth come up, and it was related to that toe. And we thought, isn't that interesting, And so once we were able to correct what was going on with that tooth, she came back and she goes, this is really crazy, but I no longer have this pain in my toe. So it can be connected to some very interesting things. And once we clear up what's going on with the dental, then a lot of things in the body can see a big change as well. Many practitioners have said that up to 80%, and we think even maybe upwards of that, of all issues in the body start in the mouth. So dental health is really super important, which is why we're so excited to be partnering with Flourish Dental, because she's really using all of these holistic practices that really can make a big difference all throughout the body. So.
And Mario, when you say that not only can the teeth affect what's downstream, down the other points of the meridian, but sometimes I'm finding the reverse to be true also. Like if all else fails, maybe there's nothing that makes sense to be wrong with a particular area of the mouth, then we look for what's downstream, down the meridian, and that could potentially be causing a problem to show up in one area of the mouth.
That is very true. Yes, we very often see that, if we're having dysfunction in an organ or in one system of the body, it definitely can affect the teeth. The thyroid is a big one. Very often when we have thyroid issues, we see a lot of inflammation in the gums. So yes, that's very true. Absolutely. So it's estimated that half of American adults suffer from gum disease. And a good many of those adults have no idea, So yeah, it's really important to have this kind of testing and to be able to see, where there are issues with the teeth, with the gums, especially the gums. Gum health is crucially important to the health of the teeth as well. If the gums are not in good health, the teeth are not going to be in good health either. So that's really important to be having good testing done to see, if you're suffering from periodontal disease, infections, even toxicity in the gums. And the reason that's important is that, as we talked about, the teeth are very connected to the rest of the body, and it very potentially can lead to things like stroke and respiratory disease and diabetes, even osteoporosis and preterm births. So all of the different areas of the body are interconnected. And so this is why whole body thermography is very important, because we can see those different connections. We can see how the teeth connect to the body, but also how the body connect to the teeth. So to your point, Dr. Ingram, if there's dysfunction going on in the body that's causing issues with the dental, we can see that as well. And so it's really important to have whole body thermography as opposed to looking at just one area of the body, because that gives us a much broader picture. So for you ladies out there, how well do you really know your breast health? And so that's very important. One of our specialties at the Thermography Center is helping people keep their parts. We need all of our parts. They're all important. And, conventional medical wisdom says, yeah, we can remove that and it's not really going to be that big deal. But all of our parts have purpose. And the breasts are no exception. And one of the things that the thermography exam does very well is look at breast health. So One of the things that we see is that periodontal disease is very connected to breast cancer. And this isn't coming from, some fringe group or anything like that. This is coming from, so this, for example, is coming from the researchers at the University of Buffalo School of Public Health. And so it's been very well documented that dental health can have a big impact on cancer, and especially on breast cancer. So statistically speaking, 93% of women with breast cancer have had one or more root canals, and then 7% had other oral pathologies. Women with gum disease, 11% or 11 times more likely to be diagnosed with breast cancer. And 75% of the adult population is at increased risk. So dental health is really, really important. And being able to see those correlations is equally as important. So this is one thing that the thermography report does. So when we look at the breast analysis page, we can see there, again, it gives us the picture on the left is the first set of readings before the cooling period. Picture on the right is the second set of readings after the cooling period, so we can see how the tissues responded. It tells us if one side is warmer than the other, so if one side's working harder than the other. It tells us very quickly all of the contributing factors and also to what extent they're contributing. So just a little close up there. So it gives us the pictorial representation. So we can kind of see there where there are blocked spots, where there's toxicity. It also gives us all of the contributing factors. So it gives us 13 different criteria for suspicion. So we can see when things like the lymphatic system are involved, when the organs like the liver and the stomach are involved, when the teeth are involved, So it can tell us how many different things are contributing to the breast health so that we can actually make a plan for improving the breast health rather than just testing and hoping, right? They tell you, get your exams every year and this is our preventative measures. But no, it's really not. All that's doing is just telling you whether something's growing there, whether it's not. But if we can actually see all the contributing factors, then we know where we need to make some adjustments in order to actually improve the health of the breasts. And so for the men, the prostate report is very similar to this. It shows us, all the contributing factors, and then also all the major, what's contributing to what extent. So it also gives us a little graph here that tells us to what extent different things are contributing. So we can see that here the lymphatic load is moderately contributing, but the really severe things that are contributing to the breast health are the organs and tissues, which is going to be things like digestion, liver. This would show up in the contributing factors as well. And then also that distant related focal, that tends to be the dental. So it gives us a lot of information here that really can be instrumental in creating a plan for better health rather than just, hoping that nothing's going to grow there. So on the third page of the thermography report, it gives us also a graphical representation of everything that we tested for. So it shows us what came up on that first page as dysfunction, but it also shows us, you can see those blue lines on the graph, it shows us what the body's doing really well. So we can see where the body's strong and functioning properly, and we can also see where there might be areas of dysfunction. And then the last page actually gives us the individual point readings for all the 119 points that we tested. And it also gives us some different numerical values. So we can see where the chaos or the disorder increased or decreased from the first set of readings to the second set of readings. So whether the body responded well overall, or whether it, in that particular area, was having some issues. We can see very quickly where we have areas of toxicity, areas of inflammation. And as thermography specialists, as deeply trained thermographers, this is the page that we're actually trained to look at. So the rest of the report is more for other practitioners or the patient, but this page is really where we get our information. Because a lot of times we can see correlations that don't show up on that first page. That first page is done by algorithms, so not everything shows up there, but we can see sometimes things that don't come up on that first page and where issues are just beginning to happen, you know, or where different things are correlating with each other. So for example, the dental and the breast health. So this gives us just a lot of information to work with. So have you ever had your lymphatic system evaluated? And the answer for most people to that is no, because unless you've had a thermogram, you haven't had your lymphatic system evaluated. And there are a lot of reasons for that. You know, one of the reasons that they don't really have a lot of testing for the lymphatic system is that they don't really have a lot of remedies for the lymphatic system. There aren't any pharmaceuticals to treat the lymphatic system. So even though there are a lot of ways that you can improve your lymphatic drainage, there aren't any medical pharmaceutical treatments for it. So for most doctors, it's just not useful to have that information. But it is a crucial piece to our overall health. So really understanding how your lymphatic system is functioning is of major importance to improving your health. And so the lymphatic system runs parallel to the cardiovascular system, head to toe. It is a major part of the immune system. It's also a major part of our detoxification pathways. And it's also part of our endocrine system. It transports our fats where they need to go so that our body can create hormones out of those fats. So it's a really central piece, and for many people, a missing piece to really improving their health. So we talked a little bit about the function. It actually does a number of different things. And it also has what we call lymph nodes. And this is where we collect toxins. We collect, you know, the good bacteria that needs to go to fight the bad bacteria, all of our things like lymphocytes, things like that. So those are kind of the traffic cops for our lymphatic system. And these are the areas also that when we're having, you know, issues in the lymphatic system, when we're having, you know, illnesses pop up, things like that, very often, you know, you get the swollen lymph glands. So that's an indication that the body's really working hard on clearing something. So the lymphatic system is really, really important. And the thermography really gives us a full picture. So it doesn't just measure the lymphatic points, it also measures things like the appendix, which is part of the lymphatic system. It measures the axillary lymph, you know, in the armpits. It measures the thymus gland, which is the governing organ for the immune system. Also the tonsils, which are part of the lymphatic system. So it really gives us a very comprehensive picture of how the lymphatic system is functioning, and also how all of the corresponding organs and tissues are functioning with that. Gives us a very in-depth cardiovascular assessment. It tells us, you know, conduction. It tells us how the heart muscle itself is doing. So if the heart muscle is strong or if it's weak. It tells us a lot about the pulmonary health, the health of the lungs. And it also tells us if we have a myocardial danger. And this is the danger of heart attack, stroke, you know, myocardial events. So that's a really important factor as well. So many things that it evaluates. This is just a short list here. There are actually many other things that it does, but these are really the main ones. And it also reveals subclinical infections. We talked about that a little bit in the beginning. Subclinical infections, you know, are things that haven't really blossomed into that full-blown infection where you have a fever, you know, where you have, you know, malaise, things like that. But they manifest in really interesting different ways. And so a lot of people that come to us, they're like, you know, they're experiencing all of these symptoms and they really haven't figured out, like, what is the root cause of that? And so this is one of the things that we look at, and the thermogram is very good at revealing. So we can tell very quickly if we have subclinical infections, viral infections, bacterial infections, dysbiosis in the gut, overgrowth of yeast, fungus, things like that. And so these are all the organs that it assesses. It assesses all of the organs except for the spleen and the bladder. But we can actually tell a little bit about the health of both of those by the way some of the other things are functioning also. So I know that most of you really can see how this can really be a tool for you to better understand your health and better understand where any symptoms that you're having are really coming from. So it's really it's very comprehensive. And so this is really a complete shift in the way that we look at health. You know, traditionally we've looked at health as, you know, the absence or presence of disease. But really this is a complete shift in looking at how well the body is balanced, you know, how well things are functioning and where the body might need some support, as opposed to just, you know, is there something growing there or do we have an infection? It also shows changes very early, sometimes 7 to 10 years before symptoms show up. And it's extremely comprehensive. There's no other test that's as comprehensive as the thermogram. And again, it's the only tool that assesses the health of the lymphatic system. So we actually make it very easy for you. We do a comprehensive educational review with every test to ensure that you really understand the results. We also have the results available immediately. So as soon as you finish your test, then we sit down with you and we go over the results. And also our highly trained staff is always available to talk to any practitioner that you might be working with. I know that Dr. Ingram is really good about anytime one of her patients brings a thermogram to her, she calls us, we sit down and we go over it just to make sure that we're catching everything. So we're always available to do that. And so if you're ready to take back your health and to get started on this, we actually have a really good special for you. We're doing a clinic with Dr. Ingram on February 26th. So for that clinic, for joining us for this lovely webinar, we have $50 off for you at our clinic. And so this is going to take place at the Flourish dental location. And if you call in the next 30 minutes, just call Raquel at our main number, give her our nice little offer code there, and she will schedule you for your thermogram at Flourish on the 26th. And she will mark your file so that we will be sure and give you that discount. And so with that, I'm going to open it up for questions. So if you have any questions, I'm here to help you with that, and just make sure that you really have a good understanding of all that we've talked about. So any questions? No?
I have one.
Mm-hmm.
I mean, for one, I'm going to go back and read my thermography report again because I feel like I learned some things that that I need to go back and look at in more detail to help me understand my own. But I know you touched briefly on the two different kinds of thermography. The one the one that you guys do is regulation thermography, very, very detailed. There's also one that uses an infrared camera. Can you kind of explain the difference between the two and why you guys like the regulation thermography so much better?
Yes. So the difference really, the main difference is that when you just have an infrared image, what you're seeing is different shades of color. Right? So really, rather than knowing a specific temperature measurement, you're seeing, you know, yellow and orange and red. So you can see areas of the body where there might be some heat going on or where there might be some cold going on, but it doesn't give us actual temperature readings. So there are specific temperatures, there are specific tolerances in that response of the body. And so it's specifically, you know, this area is supposed to respond by 1.2 degrees, right? And so we can't really tell from camera thermography, was it 1.2 degrees or was it 1.5 degrees, you know? And so that makes a really big difference. Just having that information makes a really big difference, because we can tell then, you know, is this mild problem? Is it a moderate problem? Is it a severe problem? Just those few points of a degree can make a big difference in that. And so this really gives us that specific information about the temperature. And then also, usually with camera thermography, they're only looking at one area of the body. So chiropractors very often also use this to look at the spine. You know, sports doctors sometimes will use thermography, thermographic imaging to look at a knee, you know, or an elbow, and kind of see what's going on there. And so it doesn't correlate all the different areas of the body, you know, and so this allows us to see how different areas of the body are affecting each other. So we can see, for example, if the liver is congested. So when the liver is congested, this means that the lymphatic system is probably also not moving very well. You know, so we can see that as a cause for that blocked lymph, you know, because the lymphatic system empties into the liver and the kidneys. So if the liver is not moving well, then the lymphatic system is not going to go anywhere. So we can do all the lymph work we want to, and it's not really going to help that much because we can't see that the liver is clogged. So with regulation thermography, we can actually see those things. And so we can see different areas of the body where, you know, we need to do this first, and then we need to do something else, and really create a better plan for the body. So it gives us a lot more specific information to work with.
Gotcha.
So any other questions? No? Great. Well, thank you so much.
I have a question.
Oh, yes, please.
You just talked about a plan for the body. What do you mean?
Well, one of the things that we do at the Thermography Center, aside from the diagnostics, is we have several practitioners, myself included. I'm our senior practitioner. But we have several practitioners who, if you were needing help, then we can actually put together a personalized program from that thermography report. So this really is taking into consideration everything in your thermogram, but also your health history and, you know, anything that you might be experiencing right now. We also use muscle testing to determine if this is a good fit for the body. So for any different symptoms, any different dysfunctions, there might be several different ways of addressing that. So we use the muscle testing to know whether, you know, each individual type of treatment is going to be a good fit for you personally. So we do very personalized, comprehensive programs based on that.
So is that like through supplementation, that type of thing?
Yeah, so it can be some supplementation, could be dietary changes, could be physical activity changes, you know, lifestyle changes, could be therapies. We do offer several different therapies as well. It also could be, you know, sending you to a different practitioner. So for example, if we see dysfunction in the teeth and gums, we might recommend that you go see Dr. Ingram to address what's going on with the dental. So there are a number of different modalities that we work with.
Okay.
Yeah.
Now I heard about thermography before, but it seemed like there was different levels of thermography that you could have, each one costing a different amount. If they did this, you know, it was this amount. If it was this. So I didn't know, how is this one?
So we only do whole body thermography. We don't have any different levels. There's just only one way that we do it. And so it's the same for every patient. We do all the same points. We do all the same recommendation or reading of the reports. We do the same process for every single person.
Okay.
Anything else? No? All right. Well, thank you guys very much for joining us this evening. And, if you'd like to go ahead and get scheduled for your exam and get that 50% off, do give Raquel a call right away. And she will get you set up with that. And then if you can't make it on the 26th, do please call us anyway and get on the schedule. You can do that at the Thermography Center. We're at Spring Valley in the Tollway, so we're very centrally located, and we would love to see you. So with that, I'm going to close it out, and hopefully we will see you guys very soon.
Thanks, Dr. Cordell.
Thank you so much. Thanks.
All right.
Thanks, guys. Thanks for joining.
So do I? Okay.